Good morning, everyone. One more time with some real energy. Good morning. Attaway. We could be a choir. That's pretty good. I'm going to work on that. Hi, I'm Richard, and I'm really excited to welcome you all here. As those of you that have been here for a few years know, I usually start off saying, how about those Eagles? But this year, the best you can do is, how about those Temple Owls? And how about the Penn State Nittany Lions? Now, does anyone else have a team like a junior high school, grammar school, high school? Anyone you got? Yell it out. What's your team? Attaway. We have Dan with the Steelers up here, so we won't even mention that. But we're really excited to have all of you here. Just take a moment and look around and look at the fabric of PHMC and our affiliates and the family. And when I look out, and I can't totally see all of you, but when I look out, I'm so proud, and I know all of you are, not only for the diversity of all of us, the excitement of all of us, but the work that each of you do every day. So I do this a lot, but let me just say, thank you, thank you, thank you to each of you for what you do every day. So my applause to you. And while I'm thanking people, I want to thank Lauren and Patty and the communications team for putting this together. A big round of applause for them. And Michael and the IS team for making all of the video things work, and Rhonda and her team for making the lunches work later, and I could go on, but I'll just leave it for that right now. But thank you so much. I really appreciate it. We're also going to kick off today's meeting with a live polling question. We included this feature last year, and everyone seemed to really like it. So behind me are the instructions on the screen. And take out your phone. The first thing I want you to do with your phone is make sure that the ringer is off so no one's embarrassed. And we don't need another wild thing happening this morning. And then answer the first question, and let's see how we poll. Are you all doing it? Oh, okay. We have results, but the results don't seem to be going. So when they are, we'll put them up because we want everyone to see the results. But through the meeting, there'll be several questions, and please keep your phone out and answer the questions. We're really excited that there's over 1,000 people here today, which is always interesting. About 800 and some people RSVP'd, 1,000 are here. We have about 2,500 colleagues altogether, but most of those people are at their places serving people. And today, when you're having lunch, hopefully as many of you as possible will be having lunch at 1,500 or at your place where your office is. So we're really excited to have everyone. We're excited to have the people from 1,500, from across our programs throughout the region, the Philadelphia City employees that are here, all of our affiliates, and we welcome all of you. It's very, very exciting. I also want to welcome two of our board members who are here today. Wendell Pritchett and Ted Christopher are here, and we want a round of applause for our board to thank them. This is the one time of year that we all can get together, and it takes a lot of effort to bring us together, and it's really great to have you all have a chance to see all of your colleagues and talk to them. So when we're done, I hope you take a few minutes just to look around, talk to people, and connect. Connection is a part of what we do to make sure that we're serving all of the people, families, and communities that we serve. So please make new connections and renew the old ones. And it's a time to thank each other. And again, please, thank you to everyone for everything. Due to the nature of our work and those we serve, it's impossible for all of our staff to be here. So I want to take a moment and thank all of our PHMC colleagues across the enterprise for all the work they do, and the ones in particular that can't be here today with us because they're serving our clients. Those in the health centers treating patients, those in our residential and outpatient facilities tending to our clients, others in case management and other forms of social work who need to be with PHMC participants and their families today, and others during this critical public health, doing the critical public health work that we each do all day that makes PHMC and our affiliates the amazing agency and institute that we are. I greatly appreciate everything that everyone's doing, and again, big thanks to you. Today's meeting is being recorded and will be made available for all PHMC employees to watch at a later time. So when you look, you'll get an email about it. You can look online and see everything that went on today. Not sure that you want to see me twice, but you can just speed through me and look at the other people. It'll work better. And when many of us are having lunch back at 1500, our other locations will be having lunch also. We've made sure to send lunch to all the other locations, so we'll be having lunch together. Now let's talk about what's in store for us today. Following last year's meeting, we gathered feedback from you on what you liked and what you didn't like. And you told us that you enjoyed the Crystal Tea Room, where we are. Let's hear it for the staff of the Crystal Tea Room. But some of you had a hard time seeing the screens and the graphics. So this year we have intermediate level screens going back. So I hope everyone can see. Clap if you can see. Clap if you can't see. Great. You love the videos and wanted to hear more from our clients and their success stories. We're proud to bring you more client stories and videos this year. You wanted to hear from more people, less me, more other people. I'm with you all the way. And so you'll hear from more of your colleagues and the work that they do throughout the enterprise. And lastly, you all appreciated and valued the Impact Award and how we highlighted your fellow colleagues. The 2016 Impact Award winner will be unveiled toward the end of this presentation, so stick with us. That's called the tease in the business. This year's theme is the continuation of the storyline from the past 2 years. This is who we are, this is how it's done, and today, this is why it matters. And that's why you see the theme up there. Our meetings for the next 2 hours, so pace yourself, will focus on what we do at why what we do at PHMC matters to our clients, our communities, our partners, and to all of us. We'll tell the story through 5 chapters. And you have to be careful when you list 5 chapters, because if you try and do it by heart, you always miss one of them, so I'm going to read them. This is why financials matter. This is why centralization matters. This is why mission-driven growth matters. This is why thought leadership matters. And the most important thing, this is why you matter. And all throughout, you'll hear and see various speakers, videos, and even a live performance. Every year, we try to bring you a robust program that helps you learn more about PHMC and how you fit into our work. And we try to recognize and highlight as many of the areas of our business as possible. But as you know, it's virtually impossible to do so. We appreciate the work that each of you does across all of the PHMC family. If you don't see your business area highlighted or your program named specifically today, please know that we care about you and the work that you do, and we thank you all the time. Every year, someone comes up to one of us and says, you didn't mention my program, and I wish we could mention every program every year. But the fact is that we can only show a highlight, and each of the programs we talk about represents what you do and the work that you do all the time. And so we thank all of you. The stories about these individuals, and we can only do a few, are the stories of the families that you all see all the time, and we recognize that. Before I turn the mic over to Marino, I want to take a few moments to recap the last year and set the stage for 2017. I think some of you have noticed that 2016 has been an exciting year. Exciting is a word that has many nuances. Let's first talk about who we are and how we make up PHMC. We're a network of more than 350 programs and 13 affiliate subsidiaries, including our holding subsidiaries. Our staff is made up of 68% minorities and 77% women. The majority of our staff live in Philadelphia. And our senior leadership team and board are each made up of 50% minorities. Together, we serve more than 350,000 people a year, 90% of whom are at risk, primarily economic risk. That's a really powerful impact on the community we serve, and I hope that each of you appreciate that. On average, each client we serve receives at least 2 PHMC services, demonstrating our ultimate goal to wrap services around each individual and each family we serve. I hope next year when I stand up here, each person that we serve's family receives at least 4 services, and that's our goal. Last year, we previewed PHMC new 3-year strategic plan. We're really excited. We think it's a really robust plan that serves our communities. We're in year 2 this year, and our core focus areas truly define how we achieve our mission and create and sustain healthier communities. The focus areas, as hopefully you all know, are thought leadership, what we do, mission-driven growth, why we do it, and centralization, how we do it. And those things really impact on the entire enterprise and all the work that we do. And one of our biggest areas of thought leadership this year was opening the Early Learning Academy at Center Square. There are over 70 little scholars currently in residence at the Early Learning Academy. And I want to thank Natalie and Amanda and their team for the incredible work that they've done, and many other people throughout the enterprise to have it open. The Early Learning Academy has taken our corporate commitment to delivering quality early childhood education and married it to PHMC's dedication to our employees and our communities. We also weaved in our innovative design philosophy. If you haven't been down there to visit, we'd love to make sure that you see it. It really does integrate design-driven culture into the work that we do. The Early Learning Academy at Center Square is a high-quality child care center located right at 1500. It's sponsored by PHMC and available to any PHMC or affiliate employee at rates discounted from the community rates. The ELA is managed by Bright Horizons, the leader in employee-sponsored high-quality child care and education. And that's an important thing. We do much of the work that each of you do every day in partnership with others. And those partnerships are relationships. And as many of you heard me say, relationships are really the core of how we deliver public health services across the region. We currently have about 70 young scholars enrolled. 10 of those are PHMC's employee family children. We realize not every PHMC employee needs child care, and not everyone who does is conveniently located at 1500 Market. But many of you know other people that need this high-quality service. So we ask each of you, our ambassadors, our salespeople, talk to the people you know, your neighbors, your friends, your colleagues, and suggest to them they consider the ELA as a place to have their child enrolled. It's been a really exciting thing, and one of the real highs is getting a chance to go down and see the children that we have the privilege of serving every day. It's an amazing group of kids. And speaking of early childhood education, one of Mayor Kenny's biggest initiatives has been the expansion of high-quality pre-kindergarten throughout Philadelphia. I'm sure all of you have heard about that. I'm proud to share with you that this fall, PHMC was selected as the city's administrative intermediary for the rollout of Philadelphia Pre-K, the city's effort to launch 2,000 new high-quality pre-kindergarten seats in areas in need of this that will start in January. So the team at PHMC has been responsible to provide 2,000 high-quality slots in a very short period of time. Again, congratulations to Natalie, Amanda, and the entire ECE team for all the work they've done to do that. It's going to be exciting because we started 2,000 slots. We're going to move over the next couple of years to 6,000 slots, which is an amazing development for all of Philadelphia, and it will have enormous impact. Another area this year where PHMC has shown thought leadership as well as grown mission-driven aligned work is in response to the current opiate epidemic plaguing our city and state. As you know, over the Thanksgiving weekend, 7 people died in one neighborhood in Philadelphia. Between 3 and 7 people die every day in Philadelphia for opiate overdose, and not enough is being done about it. We hope to help lead the community to make sure that we have appropriate responses. These tragedies know no gender, race, socioeconomic status, or religious barriers. It's happening to everyone in every community. In Pennsylvania last year, 10.3 million opiate prescriptions were filled. That's nearly 1 for every person in the state. And if you think about that, and you think about the number of pills and where those pills end up, you have some sense of how this has happened. As a public health institute, it's our duty and our responsibility to say enough is enough. And we'll be working with a group of leaders, partners, funders in the field to try and find answers and to leverage responses. We have a long way to go, but this year, the Integrative Health Services team, currently led by Donetta and Angie, have made great strides in working with federal, state, and local funders to address this growing epidemic. The Department of Health and Human Services provided funding to expand treatment of substance abuse disorders, including medication-assisted treatment, as a part of integrated healthcare. PHMC was named a Center of Excellence by the state, setting up a team-based treatment approach to integrate primary and behavioral health. And just this year, PHMC launched Pathways to Recovery, a partial hospitalization program addressing the co-occurring issue of addiction and mental illness. And I should say that that program has been open a very short time and is rapidly approaching capacity. And so it's an amazing response to a really important problem facing our city. We have a long way to go as a city, state, and country, but I'm proud of the Integrated Health Services team for its vision and response in serving communities and beginning to address this issue. Again, to Angie, Donetta, and their team, thank you so much. And there's so much more to do, and it'll be an exciting time ahead for PHMC in this world. This past year, PHMC weathered the storm during the state's budget impasse that lasted nearly 9 months. It seems like so long ago, but it was only a year ago that we were facing all of this. Marino and Don Holden will talk more about this in more detail in a few moments, but I wanted to congratulate our PHMC management, especially our financial staff, for all of your focus on ensuring PHMC stayed fiscally solvent and strong and served as an example for other nonprofits by helping to support agencies and partners across the state during multiple months of delayed non-payments. Not only were all of our employees paid throughout this, but we managed to help a number of partner agencies receive the funding they needed to pay their staffs. So a round of applause for all the fiscal and management people for what they've done. PHMC's fiscal foundation and our dedicated and committed staff are what got us through to the other side, and now we're serving in a capacity to help drive policy change at the state level so this never happens again. Briefly, we're involved in lobbying to try and make sure that state government, when it doesn't pass a budget, can't stop paying providers of public health, social service, and educational agencies so that we can continue to deliver our work, and we hope to be able to not have this happen in the future. It's been, as I started to say earlier, it's been a really interesting few weeks and months, hasn't it? We had an election. I think it's really shaken the roots of the country in many ways, but we all know that we do our work regardless of what's going on, and we'll be doing our work going on. Regardless of your political affiliation or personal viewpoint, I think we've all been feeling a bit overwhelmed by the contentious nature of the recent campaign and elections. I assure you that PHMC will continue to advocate for and continue our commitment to serving the populations and communities that we've been committed to serving in the past. We won't let divisive rhetoric, bullying, or politics get into the way of our mission. Now more than ever, we need to be as inclusive as possible to work together to fight for the needed funding for disadvantaged communities. And I think the way that we do that is all working together, remaining focused on our work, remaining focused on our mission so that we can serve the people that we need to. In my 36 years here, hard to believe, I look so young, at PHMC, we've transitioned many administrations and experienced an incredible amount of change. We will stay the course, remain strong, and work together to ensure that public health is a top priority in this region, in the state, and the country. And the way that we need to do that is all of you. We need to remain focused. And speaking of change, as many of you know, we've experienced some leadership changes at PHMC over the past few months. Change is always good, it provides opportunity, but it's always a time of challenge to do the things that we're doing. We currently have a transitional organization chart as we work to solidify the best possible leadership and organizational structure now and into the future. And I assure you that will always be true. Our work is to support the work that you do, giving you the best organizational structure, the best set of relationships so that we can do the best work that we can. I want to again thank you for your hard work and commitment, for your patience, for your flexibility as we manage through the transition and into the next phase of our work. And as I said, that's why I'm always excited about what we do. It's always new opportunities to serve our families, our communities, the people that we serve better. And I know that all of us together will do that. This is why our financials matter. So I'd like to turn it over to our Chief Financial Officer, Marino Politi, who's going to talk to you more about this. This is the highlight for many of you every year, but Marino has a different script, and he's really excited about telling you about our financials in a different way. So a huge round of applause for Marino Politi.
Thank you, Richard. Good morning to everyone. And yes, Richard is right. There is a new script this year. I usually represent our financial health by the mission, the money to mission triangle, which has the mission on the top and the funding at one aspect and the capacity at the other aspect, supporting the mission. But in line with PHMC's new strategic initiative, we're going to represent those interdependencies by the new focus on centralization, mission-driven growth, and thought leadership. But one of the really important aspects of PHMC's financial strength continues to be the fact that we have clean audits. We've had clean audits now for as long as I've been here, which is 6 months less than Richard, believe it or not. So with no management letter comments. And by a clean audit, we're really talking about the gold standard in the highest level that a nonprofit can obtain. It's an unqualified audit opinion. And really, that's a reflection not only on the financial staff, but on all the program folks and all the work that you all do, because it really encompasses the regulatory and compliance area, the service delivery, and everything that everyone in this room does. So please give yourself a round of applause for that. Thank you. As Richard mentioned, fiscal year 16 was a little bit of a challenge in the fact that the state had this prolonged 9-month short budget. They weren't at budget impasse, if you will. During that time, it was a fairly challenging time for most nonprofits, as well as for PHMC. Our normal accounts receivables, what our funders owe PHMC at any time, is typically in the range of $30 to $35 million. Andy, is that correct? Is Andy? He knows that for sure. During that time of the budget impasse, our receivables actually ballooned to almost $60 million collectively as an enterprise. That's a serious and a significant amount of money that we were owed by the state. We were able, and I haven't been able to anyone buy a loaf of bread with receivables. So we were able to work with our bankers because of our strong financial relationships with the bank and the fact that we consistently generate operating surpluses to have a temporary increase in our line of credit. And we were able to continue to pay, as Richard mentioned, not only our staff and our vendors, but also many of the providers and fiscal intermediaries that rely on PHMC to be a solid financial agency. So that really demonstrated the stewardship that folks entrust in PHMC, and that the fiscal staff really take to heart in how we manage PHMC dollars. So, as it says here, this is why financials matters. Allows PHMC to weather the difficult times, to ensure that we continue to deliver services to clients and support our financial obligation to staff and our partners. Since I've been at PHMC, we've gone from 30 employees and $2 million to where we are now, hundreds of millions of dollars. And we're now sort of the large General Motors nonprofit, sort of the higher you climb up on the flagpole, the more you see of the monkey's butt, you know. Everyone sort of watches where we are and what we do. So, and that has advantages and disadvantages. But being a large nonprofit for us has significant advantages in the sense that we can diversify our funding. We have revenue from many different sources and different fee-for-service revenue, program-funded revenue. So it helps us ensure, this again helps us ensure the uninterrupted services and continuation of critical, essential services during times when we have delays in payment. And as Richard mentioned, Lauren and folks have been up to Harrisburg and served on a committee to ensure that nonprofits like PHMC move from non-essential services to essential services in the event that another budget impasse occurs. Now, moving on to the numbers. Couldn't get away without saying at least some numbers. You'll see the annual revenue chart is brought up, which shows PHMC's revenue growth from 2007 to 17, which is over a 10-year period. Again, it's a positive trend. For fiscal year 16, we had operating revenue of $218 million, which was up 8% from the previous year, and we had a modest surplus as an enterprise of around 1% of gross revenue. I just will stress that the surpluses, not every program we know can generate surpluses, but they're really critical. They allow us to invest in PHMC and in our staff and provide needed working capital, and that is the lifeblood that the bank, when the banks look at PHMC, that they focus on our mission, but also how we manage our dollars are really important. For fiscal year 17, I'm happy to report that our budget will be $259 million, an 18% increase, and we have a margin of about 0.5%. Again, we don't need to make much, but we need to show positive bottom line. In terms of our funding, PHMC's funding mix for fiscal year 17 is not much different than it's been over the past fiscal years. About 57% of that funding comes from city government, which includes our intermediary services around out-of-school time and other programs like that, and then the 47% comes from various federal, state, and city sources, and about 2 or 3% from Foundation and United Ways. That Foundation and United Way money is really, although small in dollars, it's critical and helps us leverage a lot of important things because it's one of the few areas where we can have some flexibility in what we do and how we do things. So that funding mix supports about 500 different programs in the forms of grants, contracts, and awards that you all work on, and that allows you all to develop focus, a service delivery model to deliver services to clients. And one of the things that we're really looking for, and one of the pushes as part of our strategic development, is how can we wrap these services as initial services around other services at PHMC to better serve the needs of our clients and to be a more comprehensive and like one-stop, top-stop organization. So that's part of our strategic plan, and that's where we're looking to move. Ultimately, though, through our service delivery, we've executed our mission to create and sustain healthier communities, meeting and exceeding funders' developments, and again, refocusing on our strong financial base. The fiscal strength is key to how PHMC is able to continue to provide a wide range of incredible public health services to our community year after year. That was a paid speech. No. But no, that really is important. I mean, that is what we're all here to do, and I really do appreciate the fact that all of you are out there every day doing that work. Now I'd like to introduce Dawn Holden, Turning Point for Children, who will talk about ways that PHMC and Turning Point worked collaboratively to ensure that Turning Point was able to provide uninterrupted services during the budget impasse. Thank you.
Good morning, everyone. I'm proud to talk to you for just a couple of minutes about the fiscal partnership between Turning Points and PHMC. Marino happened to mention that some of the programs have a surplus. Unfortunately, Turning Points does not happen to be one of the affiliates that, even though we've experienced great growth, we haven't actually turned a profit in a few years. And so that is something that we need to change. And PHMC has still been quite supportive of us through all of our growth and integration challenges. So as Marino mentioned, during 2015, there was a budget impasse. And I don't know how much people follow that, but for people like Marino and I, that essentially meant that for 9 months, there was no money coming to our organizations, yet we needed to make payroll every 2 weeks for everyone that works here, as well as provide all the services that the families that we serve have become accustomed to receiving and actually critically need. So for Turning Points, who has about 350 employees, PHMC, when our funds ran out, leveraged their collective resources to make sure that not only their staff were paid, but our staff were paid every 2 weeks. And all of our programs continued to serve thousands of people. And so, I'm grateful for that. I know what that means. I have peers who are CFOs of other organizations who had to lay people off, furlough people, reduce salaries, and cut programming. And that's something that we didn't have to do because of this partnership. When we chose to affiliate in 2013 with PHMC, it was always centered around the belief that we would be stronger together, but we had no idea that this is what stronger together would actually look like. Just last week, Turning Points actually secured additional funding so that we can increase our line of credit and not be such heavy utilizers of the PHMC line of credit, as well as we got funding to actually cover the cost of the renovation for our new KUA 9 space that's in Southwest Philadelphia. And the terms that we were able to receive from the bank wouldn't have been possible without the backing of PHMC. For me, one of the things that's most exciting, Marina, I'm going to look at you, not most important, but most exciting about our partnership has been our partnership with the Public Health Fund. The Public Health Fund, I'm not sure how much everybody reads their emails, but every year they've been launching opportunities for individuals within the family of organizations to submit ideas for for programming that we'd like to expand, for things that we'd like to see changed and grown. And Turning Points has been a recipient for the last few years of these impact grants. And this has allowed us to pilot things, expand services to families that, we want to desperately increase the service capacity, and it's given us the opportunity to do that. So we are ever so grateful for this fiscal partnership, and we recognize that a lot of the things that we've been able to achieve just wouldn't be achievable and attainable on our own. With that, we are going to now move into our next live polling question. So we'll ask that you take a moment to respond. And after the polling question, we'll hear from Mike McCain. Thank you.
There we go. So while everyone submits their answers for the financial question, I've been asked to deliver the results of the first question. First question, being a 4 for 4 type of city, I needed to deliver the hard news for everyone. The Sixers pulled out 17% of the vote. The Eagles, 16%. Who said Steelers? That had to be Dan. The Phillies with a 21% gap. And thank you, everyone. The Flyers with 46%. Round of applause. I want everyone to know I've already been accused of rigging that question. Thanks, Dan. Great. So everyone, your confidence in the financial stature of PHMC is very, very encouraging. Going through what we went through over this last year was not only challenging, it showed stress in different areas. So thank you, Dawn, and thank you, Marino, for that portion. I've been asked to introduce centralization today. So centralization was introduced as a part of our strategic plan in 2014. Since then, it's developed into a foundational element of how we approach our work on a daily basis. Centralization has and will create opportunities for many things. It allows information we gather day to day to be used to improve the outcomes for all. It allows quality to be a focus for all of our programs. It is how we're able to create positive, welcoming facilities for our clients. It allows us to continue to do the important work we do with situations like the budget impasse. It allows us the opportunity to continue to develop ourselves as leaders and many more. We're stronger together. more than we are as individual programs and affiliates. This is why centralization matters. As an enterprise, there are many centralized support services that support the needs of our programs. All of these that you see listed here over the past year have been working together to integrate these services for our program operations. Integration can easily be described as our ability to work together to create better outcomes for our community by wrapping services around individuals and families. By doing that, we're achieving greater enterprise transparency on a few key important questions. Who's doing what? How's it going? What roadblocks exist? What's our path forward? These create some results. Centralization is a shared responsibility for outcomes. Centralization's a shared accountability for outcomes. It's shared resources to overcome any challenge. It's a shared vision for the future of our community. Because of our efforts towards centralization, we're now in a much stronger position to provide greater access to information and to more effectively deliver our services. Our shared responsibilities and our shared vision can create the future that for the people we continue to serve. This is why centralization matters. Now, we're going to give you some examples of centralization and allow some of our leaders to share the stories with you. When centralization works, leaders emerge as the vehicle to create that shared vision. One example of this shared vision in action is a project we completed this year with the team from our Forensic Services Division. Please help me in welcoming one of my favorite leaders in public health and our Senior Director of Criminal Justice Initiatives, Lori Corbin.
Good morning, everyone. I'm very happy to be here this morning to talk a little bit about the partnership Forensic Services and Information Systems worked on or partnered with over the past 18 months to integrate the Forensic Services program into PHMC's client registry system. The client registry system is the participant documentation system that has been utilized by a number of our BHS programs over the years. However, Forensic Services was not a part of that because it had its own database or data collection system known as the FIR database, which had been around since 1997. This was a huge project. And I can tell you from the Forensic Services side, we were a little nervous moving forward with it. And I'm sure on the IS side, they were probably a little nervous as well. But we knew that we needed to work in partnership in order to achieve our goal, which was to develop a more robust system to better meet the needs of our staff, our collaborating partners, as well as our participants. For our staff, what it meant as we move forward was to continue to be able to accurately document the hard work that they do on a day-to-day basis. And in that work, be able to also bill for services as we have continued to expand our fee-for-service programming over the past several years. For our criminal justice partners, it was important for them to be able to get information that we generated from our documentation system to help support their efforts to divert individuals from the criminal justice system through our various and disparate criminal justice initiatives. And for our other funders and collaborating partners, they were looking for new ways to work with us to improve their efficiencies in how they work, as well as, to be very honest, to reduce the paper and the communication and other mechanisms that we were having that were a little antiquated, considering that we were now in 2016. This required us to step out on faith in working with IS and realizing that only through the partnership were we going to be able to achieve our goal. Well, a year later, almost, because we launched in February 2016, we've had a lot of success. We've implemented a new system, and it was scary. There were a lot of challenges in the very beginning, and we had some disagreements. But that's okay. As Richard said about relationships with our external partners, it was important for us to establish that relationship and that trust with our internal partners as well. And through that growth, we have a better appreciation and understanding for the work that each subject area brings to the table. Information systems is the subject matter expert in technology. Forensic Services is the subject matter expert in criminal justice. Bringing those two together to complement we were able to achieve our goal. I think the biggest reward out of this, from my perspective, is that information systems really has a great understanding of our business practices and requirements. And in that, they were able to develop a system to better meet the needs of our participants by giving us features and functionality to improve our workflow. From the forensic services side, we have a great appreciation now for all the work that it goes into the application, as we were in partnership, daily meetings, sometimes weekly meetings, in moving that forward. And also, the great news is that our collaborating partners on the outside, who were a bit skeptical that we were going to be able to accomplish what we did, have given us nothing but positive feedback, and it has increased our credibility, not just as a program, but as an organization, in order to deliver on what we said that we're setting out to do. So what we're looking for in the future is, we have the foundation now. We're looking for the bells and the whistles and the extra stuff that will make things really more efficient and functional for us moving forward. We're looking to do things such as making referrals and tracking referrals through the CRS system, including coordinating with PHMC's Refers platform. We have looked to embed, which I'm really excited about, some of the participant documents into the actual application itself to significantly reduce our paper, as well as to make things more efficient, again, for our folks who are out in the field. And about 85% of the staff of forensic services are out in the field. And then, as importantly, to improve our data collection and management and reporting, because outcomes is very important for us, for our continued funding in the current environment that we're in, but also to access new dollars to support continued programming. So all that being said, I want to thank IT for their support over the last year. I want to thank my team in forensic services for the leadership that you also gave in moving this forward, because that centralized support has been so valuable for us as we have continued to grow as a program area. And at this time, I'd like to introduce both Emily Weiner and Sarah Melina Robinson, who will talk a little bit more about their perspective on the value of centralization.
Here in the Philadelphia region, our community is a rich ecosystem. Different kinds of people with different kinds of public health needs. Lots of services exist within our region, but it's not always easy to keep track of what resources are where. That's why at Public Health Management Corporation, we focus on integrating our services to best meet our clients' diverse needs. Because our community is our families, our teachers, our children, our neighbors. Like Noel, Michael, and their children. When Michael visits one of PHMC's health centers for his back pain, he mentions that he's out of work and struggling to keep up with his bills. The nurse practitioner refers them to Clarify for financial counseling so they can manage their debt and plan for their family's future. Like the future of their daughter Jess, who gets early childhood education through the Philadelphia Head Start Partnership. Jess's friend, Kira, who is in foster care, placed through Turning Points for Children, and was referred to an after-school program supported by the Out of School Time Initiative, where she plays with James, whose parents receive ChildLink supports coordination for their daughter, Bella, who has developmental delays. Their next-door neighbor, Alice, has left an abusive relationship in the past with support from the Joseph J. Peters Institute, and her best friend, Frank, is ready to undergo substance abuse treatment after completing a program with New Pathways. Frank's daughter, Ella, received job training from the Workforce Institute, and her boyfriend, Jason, who received his health information technology degree from the Workforce Institute City College, and now has a full-time position in the PHMC Health Network. Creating and sustaining healthier communities through public health won't come from quick fixes, but through collaboration and connected care from within our community and within the PHMC family. At PHMC, we're passionate about our work. We are committed to integrating our services in ways that allow us to deliver better solutions to those who need us most. Because our community is us. Public Health Management Corporation. Learn more at phmc.org.
Good morning, everyone. My name is Sarah Melina Robinson, and I'm the Managing Director of Social Services. Some of you may be seeing that video for the first time. while others may recall the energy in this room last year when it was introduced. Though we have a ways to go in making that video come to life as a common story, we have made major strides towards greater service integration in the past year. I'm here with Emily Weiner, our Business Integration Manager, to celebrate some of those strides with you today.
Thanks, Sarah. In February, we launched the Connections team, which comprises frontline employees from across our organization, from Chances to NNCC's Safe and Healthy Homes program and beyond. The team is charged with two goals: connect PHMC's participants to important services like healthcare or trauma counseling, and to help inform the process on how to make referrals even easier across our organization. These incredible team members have contributed invaluable feedback and have made over 250 referrals to integrated health services to date. Connections team members who are here with us today, please stand up to be recognized. Stand up, stand up, stand up. It is, I can't see you, but I know you're there. It is a privilege to partner with you, and I thank you for your unwavering commitment to creating and sustaining healthier communities. I also want to ask the Health Promotion Services staff, who are wearing tags prompting all of us to ask them about their service areas, to please stand up. I think most of you are right here. Thank you as well for promoting conversation and collaboration across our organization. I'm sure many of us will be talking to you over lunch at 1500 Market soon. Now, as you all know, there's no one-size-fits-all approach for making referrals, especially given the complex nature of the work we do each day in our programs. Using feedback from the Connections team, those using the PHMC Refers tool, programs co-locating services, and others on the front lines of delivering services, we're working toward a consistent approach that will support all of you in how you do your everyday work while leveraging centralized data and resources to truly wrap services around people more easily and effectively, as has been alluded to by many of my partners and leaders thus far.
Centralization has played a huge role in an effort this year to expand access to early intervention for young children, an important offering that helps set children up for success in school and healthy life. As many of you know, ChildLink has been the main service coordination provider for the early intervention system for over 24 years. We've partnered with PHMC Health Network leaders, IT, and communications to design a process that streamlines and centralizes referrals from our health centers to the early intervention services while keeping the focus on the frontline staff providing quality health care. Health center staff now use a few simple talking points that help facilitate a warm handoff to Emily's business integration team, who follows up with families within 2 weeks of their visit to the PHMC networks. The majority of these families will be supported by ChildLink. And it's working. To date, 133 children have been referred to early intervention, more than one per day since the initiative first kicked off in the middle of the summer.
Here at PHMC, we know that a variety of factors impact an individual's health. Now, we are well positioned to act as a holistic network and ensure that no matter which of our doors someone walks through, they have easy access to the full variety of programs and services they may need to improve their health and that of their families and communities. We have work to do, but we couldn't be more energized or eager for all of us, both program teams and central teams, to continue this journey together. Thank you very much.
Thank you.
That's great. Congratulations, Sarah and Emily. That's a really good job you guys are doing. I also want to make mention of our team over at Health Connections and their ability to ramp up the referrals to ChildLink. Great job for PHMC Health Connections. You know, there's 5 different health centers. Not only do we have PHMC Connections, there's PHMC Care Clinic, PHMC Rise and Sun, PHMC Mary Howard, and the Congresso Health Center. In all of these health centers, what we are able to do is have a integrative care. And what that integrative care is we're combining the medical along with behavior health. And in doing that, we're able to better serve our patients and meet their need when they come to our health center. An example of how that looks is a patient will come in to the health center. We will give them a screener. That screener will look to see if they have any issues with depression, anxiety, any substance use, or maybe domestic violence. And once we're able to identify they have any of these issues, we'll refer them to one of our behavioral health consultants. If it's a domestic violence thing, then maybe we would send them out to JJPI. JJPI is at some of our health centers right now. So from there, if the patient is if we're able to meet their need at that particular point, we would then have the patient go to the specialist, and then they'll be evaluated. At this particular point, our health centers are able to do a great job in their ability to serve our patients in this integrative care model that we have. I have an example of what that looks like. We have a video of one of our patients who gives us an example of how he went through the health center and was able to get services, and how the services was able to meet his need.
Well, my name is Michael Hawkins. I'm from Philadelphia, Pennsylvania, off of 12th and Poplar. It was kind of rough. There's all kinds of things going on in the project. You know, you see a lot of things that's not right. I started stealing, doing all kinds of things, you know, selling drugs. Then I got hooked on drugs. For like 33 years, I used heroin. So I took a random HIV test, and the doctor called me in, and he said, you want to sit down? I said, for what? He said, I think you need to sit down. He told me I was HIV positive. So I just happened to meet this young lady who today is my wife, and she suggested that I go to the care clinic. When I went there, it was just like I was talking to a friend. He assured me that he'll meet all my needs. I can't even begin to tell y'all what they have done. I'm talking about call on Saturdays and Sundays. Michael, you all right? Is your wife all right? I got a direct line to my doctor. It's not a time that he don't answer the phone. You know, I'm in the Overcomers meeting, 12-step. I've been clean 7 years. The PHMC got outreach programs, you know what I mean? They help the homeless. They make so many sacrifices that, you know, it make you feel like they family. So that made me want to help a lot of people that might be going through what I was going through. Man, it's a bunch of joy in my life today instead of misery. I never had any complications with my HIV since I've been at the care clinic. I'm forever grateful.
There's really no better way to introduce Alvin Kincaid, who just spoke, than that video and the kind of work that Alvin, his team, the people at all of the health centers, all the behavioral health people do every day. So a round of applause for both Alvin and all the people. Our next chapter is This is Why Mission-Driven Growth Matters. As a mission-driven organization, our entire focus is on meeting and delivering on our mission of serving our communities. Investing in growing our business isn't just for growth's sake. It's to stay relevant and to stay innovative, ensuring we're able to continue doing the work we know needs to be done. And just one quick thing about that. The number one way to ensure mission-driven growth is quality. The quality of the work that each of you do every day is really the foundation of the growth of our ability to serve our communities. And I just want to underscore that and to thank each of you for really understanding completely that quality is job number 1, 2, and 3, and that we're known throughout the communities we serve for the highest quality service. And that quality not only serves our communities and serves our consumers, but it also serves our ability to spread and advance the work that we do, this mission-driven growth. As Marino pointed out, and I'm not going to talk about that monkey, only a strong foundation can allow us to grow, and only growth allows us to keep serving communities and meeting our mission in a high-quality manner. With that, I'd like to turn the program over to Lisa Bond, the Managing Director of our Research and Evaluation Group, to talk more about this. Lisa?
everybody. Wow, this is a little bit exciting and terrifying all at the same time. And yes, I do have notes that I'm going to refer to. So I have 5 minutes to talk about why mission-driven growth matters. And I'm super excited to talk about this because it's something I really do feel pretty passionately about. I think the best way that I know how to talk about why mission-driven growth matters is to break it down and talk about it in 2 parts, mission-driven and growth. So let's start with mission-driven. What does it mean to be mission-driven? Well, what I think it means, and I think most of you would agree, is it means that you work with a purpose, you're led by values. It means you know why you're here, why you get up every day and come to work here. Let's think about it. Why do we come here to work every day? It's not because we need a job or we need a paycheck. I mean, like really, we all need those things, but we choose to come here because we believe that what we're doing makes a difference. We believe in the mission of our employer, and we share the values of our colleagues. How each of us makes a difference, how we contribute to the mission of PHMC and its affiliates may look different depending on what you do, but in the end, we're all here because we want to make a difference. We share common values about the human condition and about trying to improve people's life circumstances. We believe in things like this, right? We believe every human being has the right to high-quality health care, like we just saw. We believe that people need safe and affordable housing. That's a value that we share. We believe people with addictions disorders deserve treatment on demand. We believe every child has the right to be raised in a safe, nurturing home and has the right to a high-quality education. And we all know that mass incarceration isn't an answer to anything. So I could go on, but the common thread here is that what we believe is that we should change these things to improve the lives of our fellow citizens. And that's why we come here to do what we do every day. So let's shift the conversation from mission-driven and now talk about growth. So it's pretty easy to wrap your brain around mission-driven and why it matters. And being mission-driven feels really good. When we talk about growth, sometimes people get really uncomfortable because when we talk about growth, we're talking about size and money. So let's ask this question: does growth really matter? Do we need to grow? Yes, we really do need to grow for a few different reasons. First of all, if we're not growing, guess what? Our competitors are. And in case you didn't know it, I say this a lot, it's a dog-eat-dog world out there in the nonprofit sector. Agencies close their doors all the time because they stop growing. And when you stop growing, what that means is that you're shrinking. So yes, growth does matter. But, and this is a big but, let's be clear, it's mission-driven growth that matters. Growth for growth's sake does not help us do the work that we care about. Growth can never be at the expense of quality or mission. And ultimately, mission-driven growth isn't about money. Marino, believe it or not. It really isn't. Mission-driven growth really isn't about money. In a mission-driven organization like PHMC and its affiliates, money is a means to an end. Money allows us to do the things that we care about. It gives us access to the tools, the talent, and the resources that we need to serve the communities and families that we care about. It's exactly because of the good work that's done by the people in this room every day that PHMC and its affiliates grow. And by growing, we position ourselves to do more good. We do great mission-driven work, and that's why we're able to grow. I mean, let's face it, funders don't come knocking if they don't believe in the work you do. And you don't win grants and contracts if you deliver substandard services. Your competitors do. So I'll say it again, we do great mission-driven work, and that's why we're able to grow. So if I could just take one more minute, I'd like to share one example of how we accomplished mission-driven growth in the Research and Evaluation Group in 2016. Now, we all understand the impact that education has on health. Education is one of the strongest predictors of health. The more schooling people have, the better their health is likely to be, and this is a fact that's been proven over and over again through decades of research. Now, PHMC has been on the forefront of efforts to link public health and education. We are pioneering work in early childhood education and building effective programs for kids in out-of-school environments. But despite the connection between education and health, problems in the educational system, like high dropout rates in inner cities like Philadelphia, these problems are rarely framed as public health problems. So this past June, we were very excited in the Research and Evaluation Group to make a true public health education connection. Research for Better Schools, a small nonprofit with a 50-year history of doing excellent education-focused research, merged with PHMC. Their researchers joined our researchers. And why this merger matters for the R&E group is that it means we can do so much more to bring attention to the intersection of public health and education. So in a nutshell, we grew through a merger in a way that was totally aligned with our mission. So with that, it is now my pleasure to introduce our next speaker, Emmy Stoop, who will come up and talk more about why mission-driven growth matters at PHMC and its affiliates. Thank you very much.
Thank you, Lisa. Good morning, PHMC. It's a privilege to speak with you this morning. One of the great benefits of working here at PHMC is the ability that we have to leverage our services and networks to uniquely and creatively partner with communities to bring about change and growth. PHMC's Philadelphia Area Sexual Health Initiative, otherwise known as the PASHE Department, was branded just this past year to include all of Health Promotion Services' sexual and reproductive health programs and services. In PASHE, we believe that meaningful growth comes from within our communities and is more impactful and long-lasting when brought about in collaboration with community members. In an effort to grow PASHE's high-quality sexual and reproductive health services and increase name recognition for our services within Philadelphia, this year, PASHE launched a citywide campaign called Real Rap Philly. Real Rap Philly is both an outcome of PHMC's growing sexual and reproductive health services and an innovative approach to teen pregnancy and STI prevention. True to our mission of partnering with communities, PASHE employees work closely with the youth who we serve to design and conceptualize and even name both the Real Rap Philly campaign as well as the PASHE department. As you can see from our ads, these are 3 of our 6 ads, Real Rap Philly takes a different approach to prevention than many of the other campaigns you've probably seen. Rather than try and scare people out of having sex, because you and I know that they're probably going to do it anyway, am I right? Real Rap Philly encourages youth to engage in sexual behavior if they choose, but to do so in a safe and empowered way. We get to the heart of why making safer decisions can be challenging for our youth, As you can see, we address these real barriers and empower youth to overcome them and advocate for themselves. And I see you can already see my most exciting slide. So one of the most exciting lessons that PASHI learned this year is that our approach really works. Walking around town one Sunday afternoon with my husband and my dog, because if you know me, you know I always have to mention my dog, I came across one of the Real Rat Philly ads on a bus shelter with a message left for us. The message, I feel you. Personally, this is the best graffiti I'd ever seen. This told me that a young person saw our ad, that it spoke to them, and as a result, we've taken an important step towards earning that person's trust. This trust building and deep understanding of those we serve is what has allowed us to grow so successfully. So, as you can see, innovation in order to provide the best services possible to our clients is the name of our game. Having served as a direct service provider teaching sex ed in schools and community sites for many years, like many of us in this room, I've seen time and again how youth with disabilities are disproportionately impacted by poor health outcomes, particularly as it relates to their sexual and reproductive health. And for years, this has broken my heart. This year, PASHI took our first step towards doing something about it. In order to continue to fill gaps in services in our field, the PASHI department was recently awarded a 5-year, multi-million-dollar grant to develop and rigorously evaluate what will be the first ever teen pregnancy and STI prevention intervention for youth with autism spectrum disorder. It's pretty amazing. Thank you. Together with our research partner, PHMC's Research and Evaluation Group, PASHI is utilizing PHMC's superior services to move into uncharted territory in order to better serve clients in need. This grant will be a theater-based intervention building off of PHMC's successful history of using theater as a meaningful educational tool. With that, it's a great pleasure to introduce 2 members of the fabulous PASHI team, Paul McElwee and Walter DeShields. In just 1 second. You can applaud for them again in a second. They deserve it. Paul and Walter work on the Brother Speak project, which is an intervention research study led by R&E Group with PASHI and HPS as the intervention development and implementation partner. Brother Speak uses theater as a tool to prevent African American men ages 15 to 22 from being involved in a teen pregnancy. Paul and Walter will be sharing skits used in the Brother Speak intervention to demonstrate how PHMC uses theater as an innovative learning tool for youth. And now, please join me in welcoming Paul and Walter.
All right. Thank you, Emmy. Good morning, everyone. Thank you. I think we're about the halfway point, so let's hear that even louder to make sure I know you're all out there. Good morning, everyone. You were the loud ones in the group, so I'm Paul. This is Walter.
What's up? What's up?
As Emmy said, we work for the PASHI department within Health Promotion Systems. We are out there trying to make people aware of their own sexual health. We've heard a lot about collaboration. We work with Research and Evaluation Group on many levels, and that collaboration is so helpful. We've heard a lot about growth, and you can't have growth without listening to the people in your community. It's very important to us that all of our work is very youth-driven. We do a lot of work for youth and their families, so we really do everything we can to hear what the people in our communities are saying to develop our work. So as Emmy mentioned, we have a program called PALMS, which has been with PHMC for a very long time, since 1993, I believe, Lisa, yes? It was initially an HIV prevention program. It is now working with young men in the Philadelphia communities to prevent unplanned pregnancies. And we're very excited to be developing a program using PALMS to create awareness in sexual health for youth on the spectrum, on the autism spectrum. So we're going to give you a little taste of what we do. PALMS means promoting awareness through live movement and sound. Awareness is really the key thing. In everything we do, all the work we do, it's all about awareness. It's about self-awareness. It's about being aware of what's going on with your family and your friends and in communities and all the resources in this amazing city and that we provide. Awareness is key. Obviously, in sexual health, it's about, preventing STIs and preventing unplanned pregnancies. And again, it's important to us that we listen to the community. So Walter and I are very biased, but theater is an amazing tool to get people to create that awareness, right? So it's more, when it comes to sexual health, it's more about more than just practicing safe sex. It's about communication. It's about talking to your peers, learning how to talk to your peers and your families and your partners about sexual health. It's about setting goals for yourself and how these unplanned things could get in the way of setting those goals. So within our PALMS program, we have a skit. It's reality-based. It's based on actual youth that we have met through focus groups and professionals who work in the field. And within our intervention, we also do a lot of role-play work. So I am going to ask for a volunteer from the audience.
2 volunteers.
Don't be scared. What?
Get 2 volunteers. Two volunteers. Come on up, real quick. Just we got a couple minutes. Come on.
All right.
It is. Don't matter. Let's go.
Emily, come on up here.
Let's go.
I saw your hand.
You
Anyone
need to be
else?
here. Somebody.
All right, come on
Let's
up.
go. Don't make me do this by myself. Are we going to start and then let the sister get up here?
All right, so within the intervention, we have about 12 to 15 young men. The skit involves, come on up, involves a young man named Anthony who has gotten himself into potentially a situation with an unplanned pregnancy. Obviously, there are other issues that go on to that. Our intervention deals with all the factors that go into decision-making when it comes to sexual health and communicating, as I said, and setting goals for yourself. So within the skit that we have written, we meet Anthony and a couple of his friends and his girlfriend. But we also, within the role plays, look at other people in his life and how they help him make decisions. So we're going to do a little role play. I apologize, I don't know your name. Tiara. I'm going to give you the mic. And this is Emily. We all met Emily already. So Emily, if you don't mind hanging out by the podium for this first role play, we'll use Tiara. Tiara is going to play, use your imagination, the lead character of Anthony. And Anthony, for our purposes, is a 17-year-old from Philadelphia. He has gotten himself into potentially, as I said, an unexpected planned pregnancy. And for this particular role play, he's going to have a discussion with his mother, played by Walter.
You know, the school been calling me every day, and you cutting and you're not going to practice. What's going on, son?
I have some stuff going on, Mom.
What kind of stuff? You can talk to me about anything. What kind of stuff you got going on?
Well, you wouldn't really understand the
What are you
kind
talking
of
about? I wouldn't understand. I've been your mama for 17 years, boy.
But you're a mom, and I'm a dude, and I don't think you would understand.
Haven't I raised you to this point? You can talk to me about anything. What's going on?
I know, Mom.
You got some girl pregnant, God?
Mom, wait. All right, maybe, just a little bit.
But just a little?
Just a little bit pregnant.
Anthony, how does that work?
Well, I only
It doesn't even matter. Listen.
All right, Mom.
You can come to me about anything.
But, Mom.
I can work you through some of these issues. I care about you. I know you're doing a lot for the family. You know, it's just us and your little brother. But listen, we can work through this together. All right,
Mom.
Can you promise to talk to me more and keep me clued in?
As long as you don't nag me, Mom.
I'm not going to. No, I guess I am going to nag you, but that's not the point.
All right, Mom. All right.
Okay?
All right.
I love you, son.
I love you too, Mom.
All right.
All right.
Good job, Sarah. Good work.
Great. That was beautiful. And this is why we do what we do, to make sure that young men know that they can get someone a little bit pregnant.
I didn't know that.
Thank you.
I didn't know. Yeah. Hang on. I got something else for you.
All right. Okay, so we're going to do a second scene.
I don't know if I
shake
can
your
match
head.
that.
You're up here now. You're in it to win it, Emily.
All
We
or
know.
nothing, not a little bit. Okay.
All right. So for this scene, what you may have sort of heard there is that Anthony plays some ball. He's really good at basketball. Could use some motivation in other areas of his life, maybe his academics and things. But basketball is key to his life. So now we're going to see a scene between Anthony, played by Emily this time, and his basketball coach.
So you just missing practice now?
Coach, I don't
Practice.
I don't know what
You're
to
not
do.
Allen Iverson. You got to come
You
to
think
practice.
that?
No, you are not Allen
All
Iverson.
right.
I'm looking at you.
I know. Sorry, Coach. I just.
Listen, this
I got some
team
stuff
is
going on,
about
just a little bit.
commitment, Anthony.
I know.
We all, your teammates have other things going on.
Coach,
They
I would
rely
be here
on
if I
you.
could. Believe me.
Can you tell me why you're not here?
I got some stuff going on.
Did you get somebody pregnant? God
A
damn.
little bit, yeah. A little bit. Yes.
I had a mother call and tell me that. But, look, I just need you to focus, okay? It's okay to have a girlfriend. It's okay to have friends, all right?
Yeah.
But you made some commitments. We need you to honor those commitments.
I made a commitment to her too, and I don't know how to
understand that.
juggle it all. I
So
can
let's-
juggle on the court, I can't juggle off the court.
Yes, I think that's clear. Listen, I'm here for you, right?
Okay.
I've spoken to your mother. She's here for you too. We can help resolve all these issues, help you come up with a good plan. The first thing we need you to do is be present, though.
Okay.
Can you come to practice every day?
Yeah, I'll try.
Okay.
I got.
Some of the friends you're hanging out with?
I
I'm
know,
hearing some
I know,
things,
I know.
Anthony.
I get with school too.
You're
I
a
gotta
really
keep
good
it.
basketball player. If this behavior keeps up, the recruiters aren't going to want you to go to school there. And we really want you to go to college.
I know. I want to go too, Coach. I do.
All right, let's take it one step at a time, all right?
Yeah.
We'll make sure you get there.
Just call me Iverson.
I will not.
Okay.
Let's talk later. All right.
All right. We don't respect you.
One more time.
Tiara is not off the hook yet. That was good. So you all just learned if you ever need a professional juggler, call Emily. All right, so we're gonna do one more scene with. This is one of my favorites, I have to say. So another one of the role plays that we do, obviously, as I mentioned, Anthony is potentially going to have a child. One of his friends within the skit is already a father. It's important to know that, in this work that we do, we're doing teen pregnancy prevention, unplanned pregnancy prevention, but a lot of the people that we work with are already fathers. So it's maybe helping them to deal with that. Focus on fathers. That was not a plug at all. And helping them with maybe prevent a second unplanned pregnancy. So the next scene we're going to see is Tiara again, starring as Anthony. And Walter is going to portray Anthony's friend's young son.
Can you take me to McDonald's, Uncle Anthony? I want McDonald's.
Can we do something on the dollar menu?
No! I don't want to die. You're cheap. I want a Big Mac. Can you take me to McDonald's, Uncle Anthony?
All right. All right.
Okay, and we can play basketball later?
I gotta go.
And you
to
can read me
work.
stories tonight?
But I have to
You
go
don't
to
have a
work.
job. You're 17.
No, I won't have a job if I stay here with you.
No, I need you to stay with me. I don't know when my daddy's coming back.
I hope your daddy comes back soon.
No, he's not. He's not. Uncle Anthony, we spend it all day together.
All day?
All day.
Well, I told you
and
that.
I don't go to bed till 10
Well, I
o'clock.
told your dad I could only have you for an hour, so.
No.
Yes.
12 hours, please.
No.
We go to McDonald's first. Then we watch Disney Channel.
No.
And then we go back to McDonald's.
No.
And then we go to the park. And then we go to outer space. And then we go.
Wait
You ain't got no money.
I won't have any money.
You got
if I
Jordans on. You got money.
No.
Please.
You got Jordans on too.
I know. My daddy got them. Can you
No,
buy me
I
some
bought
Jordans?
you those.
No, you don't got no money. You can't buy no Jordans. I just want to go to McDonald's right now.
Okay,
please.
well, we'll go to McDonald's right now.
And then all day we'll
no.
hang out and we'll play.
We'll talk
and we'll go
about
to the playground.
No.
No.
We'll
go
talk
to
about the rest later.
Yes, that's what we'll do.
Okay, let's go to McDonald's
Let's
right
go to
now.
McDonald's now.
Okay, just McDonald's, that's it.
Not Happy Meal.
No, just
Big Mac.
No, just the
Big
dollar
Mac.
menu.
Super
just
size.
the dollar menu.
No, fries. You
Okay.
cheap, but you got Jordans on. That's a problem.
Okay, all right.
All right.
Good stuff. Thank you.
Awesome. Let's hear it for Tiara and Emily.
Good work. Thanks.
It's so fun. I actually used to work at a children's museum, and seeing scenes like that is actually the best birth control ever.
Ever. Didn't work for me, though. I got like 4 of them. I'm just
All right.
saying.
So we're gonna thank you for listening. But we obviously work for sexual health. Theater is a great tool with whatever you do. So if you have any questions, please feel free to ask us. We would love to collaborate with all of you, every single person in this room.
We could do this in every program.
Our specific program is called Brother Speak, and that's what it's all about. It's about giving people a voice. It's about giving the youth in this city a voice to take care of not only themselves and their sexual health, but creating a path for themselves, and that's very, very important. So thank you for your time. Live polling by applauding. Who here thinks theater is a great tool? All right. Thank you for that live poll, and on with the show.
Shout out to Brother Speak, Patchy. Holla at us.
Hi, everyone. Let's have another round of applause. Paul, Walter, Emily, and Tiara. And I helped plan the agenda and the storyline, and I am regretting going after these guys because that was awesome. So thanks, everyone. Good morning. I'm Lauren Nestler. I'm the Chief Communications Officer here at PHMC, and I'm really excited and proud to be able to talk about thought leadership, why it matters here at PHMC, and why it's important to the work that we do. PHMC, as you know, we're a public health institute. We're the PHI for Pennsylvania and for Delaware. And since 1972, we've been long-standing innovators across our region with deep expertise in public health, quality service delivery, and community engagement. You've heard a lot about that already this morning. The work we do, it's critical, it's meaningful, and it's inspiring. Our staff, all of you guys face multiple challenges each day, managing the complexities of the individuals and the families that we serve. You know that better than I do. And we're often burdened with limited resources and funding. But at the same time, we're also driven by the motivation that PHMC can do amazing things for our community, our funders and partners, and those who need our services. And to me, it's that connection and that common thread that defines PHMC's role as a thought leader. Not only in Philadelphia, but also across the country, as we're one of the leading public health institutes, both as a PHI and also a manager of nonprofit health and a nonprofit. So let's talk about some of the business areas that help define the work that we do. The business categories, the service lines. Our services can be broken down as follows. You see them on the screen behind us. Integrated health services, education, child and family social services, transitional services, research data, and evaluation. We focus every day on evidence-based guidelines to drive our work forward and quality service delivery to ensure positive outcomes for the communities we serve. And we convene partners to find creative ways to fund programs and to deliver better services. So I'm going to talk through at a high level a few programs, affiliates, services that fall within each of these categories. And as Richard mentioned at the beginning, this by no means is a comprehensive list. And we're not possibly able to name all of the in-depth work that we do. But hopefully this represents all of you out there in the audience and all of those that work in our programs and across our services. So let's start with integrated health services. We are comprised of physical and behavioral health services such as PHMC's health network that includes 5 federally qualified health centers. We have inpatient, outpatient, and residential treatment facilities serving a range of men, women, children, adolescents with behavioral health issues such as addiction and substance abuse and various forms of trauma. Many of these locations are expanding into medication-assisted treatment therapies like Richard mentioned and Alvin alluded to. And our work also includes serving as one of the city's healthcare for the homeless designees. We serve homeless shelters, and we have various outreach programs that make up our portfolio in integrated health services. Also part of integrated health services is our work with health promotion services and our PHMC affiliate Health Promotion Council, which focuses on chronic disease and prevention. You heard earlier from Emmy and her team about the work they do in adolescent sexual health and reproductive health. and our affiliate National Nurse-Led Care Consortium and their many programs and services, which focus on nurse-managed care, nurse-led care models, evidence-based home visiting programs, and national policy work. Moving on to education. This is a growing and expanding field for PHMC. Our early childhood education group focuses on expanding high-quality early childhood education by providing resources, training, technical assistance, capacity building, and advocacy. Our team has expertise ranging from after-school activities and program monitoring with out-of-school time, as well as workforce development and post-secondary education initiatives. Child and Family Social Services. Our Child and Family Social Services work helps provide case management, treatment services, and care coordination for Philadelphia families in need. Our affiliate Turning Points for Children has 2 community umbrella agencies managing foster care cases for the city, as well as the Bridge and Villa residential programs serving youth. ChildLink and PersonLink help individuals with developmental delays and intellectual disabilities get the needed care, service, and attention that they deserve. And PHMC's Parenting Collaborative is a DHS-funded program focusing on parenting education and support. And transitional services. PHMC manages a number of transitional services, helping individuals move seamlessly through various stages of their life. Our forensic services group is dedicated to reducing Philadelphia's inmate population and referring individuals to critical programs and services. And other areas such as Help Philadelphia emergency funds and our home health assessment program help get people back on their feet during times of crisis. Research, data, and evaluation. Lastly, a cornerstone of PHMC's thought leadership as a public health institute and our incredible reputation with partners, funders, in our communities is our focus on research and data to drive the work that we do. In addition to our research and evaluation group, who you heard from earlier, PHMC's Community Health Database and our Household Health Survey, which is the longest running household survey, makes up this group. It provides data over time at the county and zip code level across southeastern Pennsylvania. This focus on how information and data can help inform our program, strategy, and the work we do as an agency is critical to our work as a public health institute, and it helps define our role as a thought leader. Thought leadership matters to PHMC, it matters to our programs, and it matters to all of us. It's inherent in all of our work. It defines our current approaches, and it inspires future directions. Let's all take a moment, please, to give a round of applause to the programs and affiliates that we saw mentioned on the screen and the countless others that we did not mention. Thank you. Thank you so much for the work that you do every day to contribute to what makes PHMC so special. And now, I hope that you know a little bit more about PHMC and the work that we do. Let's go to another live polling question to see which area, wow, okay, it's starting. Which service area would you like to see PHMC expand to? Housing, elderly, veterans, or immigration? Thanks, everyone.
We're watching the race here. As you know, these aren't mutually exclusive, but it really does. It is very helpful, this kind of information from you, so thank you. Looks like housing is the winner, and housing is an amazing need across many of our programs, and we understand that. I want to thank Lauren for doing a great job at a very high level, reviewing all the programs that all of you do, so please help me help thank her. Another way PHMC is a thought leader is by giving back to those who give so much to us. This year, PHMC won the United Way Leadership Spirit of Giving Award, given to an organization who runs a best-in-class employee giving campaign. And I should just say that Rachel Perlin and Ann Callan did a great job in running the campaign with their committee, so I want to thank them for their work in running. Our campaign at last count raised over $166,000, I would say approaching $170,000 of employee giving, beating our goal by over $10,000, and that's incredible, so applause for all of you. Thanks to all of you who contributed, and your understanding that investing in our community is what helps organizations like PHMC continue to be able to do the work that we do. As several people have mentioned, the United Way money gives us the flexibility to match other money to both create and sustain programs, and it's essential to the work that we do. And just as we celebrate our investment in the United Way to further help our communities, we too recognize our employees and our investment in them through our Public Health Fund Innovation Fund. And it's one of the really exciting things that we've been able to do at PHMC, creating that innovation fund. The Public Health Fund, PHMC's grant-making foundation, offers PHMC and affiliate staff the opportunity to compete for innovation fund dollars, set aside exclusively for supporting new business models and strategic partnerships that drive the work that PHMC does. Dawn already mentioned that, and there's a number of great examples of it. PHMC is incredibly fortunate to have this fund and this opportunity, and it's one of the areas that makes us uniquely different. This is the thought leadership at work at PHMC, our own staff envisioning how to make their world better and how to create a greater impact, most times leveraging the deep passion that they have. We're incredibly proud to announce our award recipients and their work for this coming year. And as I call your name, please stand up. I'm just going to go through everyone so that at the end, everyone will be standing. The Food and Wellness Network at Tilden Middle School, Laura Crandall. The Advocacy Institute's Young City Planners Initiative, Amanda Irizarry. Call Center Expansion, Improving the Connection to Care, Hayden Karlheim. Grupo Moravivi Marla Vega. Sanctuary Farm, Andrea Vittori. Integrated Employment Specialist at PersonLink, Sarah Melina Robinson. PHMC Answers, Erica Rooney. Okay, I want you all standing up, and I want a huge round of applause to all of the Innovation Award winners. It's not only the excitement of celebrating their winning, but watching over the next year to see the difference that they've made and the new programs that they will create. I want to specifically call out Marla Vega for 1 minute and the incredible work that she and her team are doing at Grupo Moravivi. I'd like to show you a video of someone who you might remember seeing profiled briefly last year, who came to PHMC through the excellent work that Marla and her team are doing in the Latina community. Take a look.
It was June 19, 2009. I was diagnosed with aggressive breast cancer. And it was really hard for me when I was diagnosed. I was really young. I was 27. I didn't know what to do. In 2012, when I was already on my remission, I was diagnosed with cancer again. I was so angry that I didn't understand why to me. And I ended up in a psychiatric hospital for 2 weeks because I tried to kill myself. Marla Vega is the one who worked for HPC, and she reached out to me. She asked me for my name and everything, and she said, "Do you have cancer?" And I said, "Yes." I removed my wig, I removed my shirt, and I showed her my scars, everything that I went through. And she was like, "You're not by yourself anymore." She showed me how to get the resources financially, emotionally, and it was really, really important for me to get that information and that help. Now that's exactly what I do. The same thing they did to me, I'm doing it to the community. I just don't want them to go what I went through. I went through a really hard situation. Fighting cancer and then ended up in a mental institute is not the best. It didn't have to happen if I knew how to work in the system, how to navigate my system and get my help. I have a lot of resources, information. I met so many females. I want to be a role model for them, and I want to be like a leader. Now, my work out for the community is I'm giving back what they gave me, which is life.
Marlo wants to invite up our special guest.
Thank you very much for that applause, and I want to call Charito Morales.
Can we just have some applause for her, please?
Thank you all, and thank you all for the great job you're doing. I just want to say I am PHMC, I am HPC, and thank you for the opportunity for letting me work now and do what I like to do, help the communities. Thank you, Marla.
Thank you again. And that is why it matters. That's really the best statement one could make. So thank you so much to both of you. For the last few years and at each recent annual meeting, we've talked about design-driven culture and PHMC's philosophy to create space that helps enable the great work that we do across the organization. By now, many of you know what I mean when I say, because you're living and breathing it every day in our newly designed offices and sites, and we hope to continue to do that over time. For those of you who might be on the road or in the field, or others whose office might not look or feel the way the headquarters office feels in some other spaces, I want to reassure you that design-driven culture isn't just about one location or a site that looks a certain way, but it's a way of doing our work, a way of working together, no matter where we work across the organization. And we hope to get that message across in a whole host of ways over time. Employees, clients, and communities are feeling the difference. We look forward to bringing more of these design-driven culture philosophies across the organization as we not only expand and grow, but also further refine who we are as an organization and what we do.
Design is inherent in everything around us and influences how we perceive and experience the world. It could be our environment, a building, a color, or even a service that's provided. As human beings, we need to understand how our environment influences us positively, makes us feel alive, healthy, and stimulated. The essence of our day-to-day environments no longer resides in the structure alone, but how we interact with it and others, using it to advance our health and happiness.
As a public health institute, we're thought leaders in public health, but we've taken that thought leadership into the issue of design and the ability of design to influence culture and service. At the base of all of the work that we do is people. And so you have to get into the way that people work, the way that people interact, and create a design that encourages people to be as productive as they can be, to be as collaborative as they can be, to be as happy as they can be in the delivering of all of these kinds of services.
We have been long-standing innovators, bringing new ideas to the table, new ways of collaborating, new ways of working together. And the way that we look at design and how it influences the work that we do is just one other piece of what makes PHMC a really great place to be.
Employees at PHMC do amazing and very challenging work, and it's very mission-driven. And people who are drawn to mission-driven work, they want to connect with other people who are like-minded. it matters to them to feel connected to the people around them and to think that their organization cares about them just as much as they care about their work.
The shared space here really helps us because the participants that we work with, some have immediate needs that have to be addressed at any moment. Picking up the phone sometimes doesn't work as effectively if I can walk right next door. This helps speed the effectiveness for us to provide services.
Information systems is one of the most integral parts of PHMC because the direction that we're going and the world that we live in now deals with technology. PHMC Help is a concept where an employee can go directly talk to a service desk technician rather than talk with them via the phone or through email. This helps because issues can get lost in translation when you're using that type of communication. Ultimately, the PHMC service desk team increases efficiency tremendously.
Here at PHMC, we have a gym, we have a cafe, we have open staircases, we have no personal printers. You walk to a printer that's communal. There are no microwaves on each of the floors. You go down to a cafe and you speak together. You meet people that you might not have met in other places. In a variety of our other facilities, we have similar kinds of things that drive people to come together, that drive the psychology of individuals.
PHMC is a leader in design-driven culture. You could see that in the offices up above. They created that same philosophy down here. You'll see a lot of elements of nature within the facility in minor details, such as the trees throughout, the flower lights, the clouds, and with it being mostly white, it creates a very soothing environment. The colors that were chosen, the furniture that was placed in here, the spaces like our art studio and our playgrounds, everything was thought of with a purpose.
The building that we were at previously was something that we fit into as an organization. The building wasn't built for us. So we had this unique opportunity to build something that was designed for kids, that would make it easier to monitor, provide them with better opportunities to use technology in their education, provide them with more comfortable living spaces. Some of the colors, some of the quotes on the walls were provided by the kids. There's a lot of design, intentional design, that really was to help us deliver a better product to the kids as they experienced what they were going through early in their recovery process.
This space has really changed how our staff work. What you see is a team of case managers and social work staff and a supervisor very accessible to that team. What happens is it becomes impossible to not collaborate. Your whole team is right there with you. They're hearing what's going on. They're aware of resources that maybe you didn't know about. Our staff are out there working with families that are struggling with so many huge challenges. So it's very hard work. Our staff need a safe place, a warm, welcoming place to come back to kind of share the burden with each other, to kind of be a resource to each other.
PHMC was originally brought to my attention from canvassing the neighborhood. I like the idea there are predominantly nurses here. I like the idea that they talk to you and not at you. I like the idea that they're more so into preventive care. My whole family pretty much attends because of that. The idea that they have like the smart boards. And I've seen the kids like, they're playing on the walls, you know what I'm saying? It's not what you expect when you come in. Whoever designed it had in mind of, no, let's think out the box. Let's not have those crazy grays and blues and hues that just depress you. Let's make it bright.
I came about becoming a service coordinator through my son. He needed early intervention services. I like that everything is mobile and relaxed. I don't have to stay in the same area. We don't have cubicles anymore. It's more welcoming. It's more of us united because, you know, we get to see other departments, whereas though before when we was at our old location, we were just stuck as just ChildLink. Ronald has improved over the years through the therapies that he received through ChildLink, Elwin, and now PersonLink, and we take it one day at a time with him. I'm proud to be his mother, and I'm proud of him.
When I was 13, I started using drugs heavy. When I first got here, no, everything was just negative. Everything was like nerve-wracking. I just wanted to leave. I wanted to run. There's like a lot of things to offer. We have a lot of rooms. We have a game room, which consists of video games, ping pong table, board games. We have a weight room for exercising. We have a Moy room, which has just like a really like big TV in there, and we have bean bags in there. We can sit down and relax. I've never been to any placement that had this much. I feel like I'm a whole different person. But a different person in a better way.
The whole philosophy of design-driven culture started with our headquarters location, but it slowly permeated across multiple settings, even sites across the PHMC network that don't look and feel the exact way that headquarters and other sites do. We're working to infuse the philosophies of how space can help influence the work that we do, how we do it, and how we serve our clients. We're really seeing momentum. We're seeing people inspired by one another. We're feeling and we're experiencing the energy of how the space contributes to who PHMC is, what we do, and how we do it.
The great thing about design-driven culture is it's a living concept. It's something we want to do more and more of. The leadership team here sees every challenge as an opportunity. The staff that work here at every level brings alive the dream, the belief that we're here to serve our communities and the people that we serve as best we can. And I couldn't be prouder to work with this team, with this board, all of our funders, all of our partners to do great things into the future.
Design influences culture, which in turn directly impacts how we achieve our mission and continue to serve our communities. This is why it matters.
I want to thank Lauren, Patty, Jeff, the film's producer, their team for the great job that they did on that. And I also want to thank all of you, the stars of the film. Well, we won't pay attention to my little thing, but the rest of you were terrific. And thank you very much. So applause for the film again. It's my pleasure now to turn the podium over to Celeste Collins, our Chief Human Resources or Person Officer at PHMC, to talk a little bit about why you matter.
It's actually People Officer. Actually, Emily, what matters to me right now are those glasses. Can I have those? I didn't start out this way many years ago. Well, good morning. As Richard said, I'm Celeste Collins. I am the People Officer at PHMC and for our affiliates or subsidiaries. So good morning and welcome. I sat here enjoying, I'm going to call it a show. Walter, I need to hire you for multiple reasons. So, as well as McDonald's. If you can do that for McDonald's, their sales will be up by the fact that they're down by 20. Incredible. This is an easy chapter for me. You've all heard and seen why you matter throughout this morning. So give yourselves a huge hand of applause for. So while I have a script and I'm going to stick to it, I have the easier job in my chapter. I'll say that the final chapter of this segment today is why you matter, but it's not. It's an ongoing chapter. You all really do make the difference. Our employees, our teams, all of us, as we've heard from our leaders, employees, and clients throughout this morning, as we've seen in the videos, the visuals, and the amazing, incredible, and inspirational live performances today, you matter. It is clear that the work that we do here at PHMC matters to you and to our communities. And all of you matter to PHMC. You are the ones every day who tirelessly commit to focusing on quality service delivery. That's critically important. You are finding creative ways, and I do mean creative ways, to meet our clients' needs, and you're taking extra time to care for families and for their families as well. Whether you're working hard to meet those deadlines or pulling together a variety of partners to finish that grant, and I've been here in the wee hours of the morning or knowing that it does take that amount of effort on your part. You are a critical component to what makes PHMC so special. It is you. And PHMC works hard to invest in you each and every day as you invest in us. We bring you comprehensive and well-rounded benefits to serve your health and well-being. At PHMC, we're proud of the investment in our employees, our continued investment in our employees, our commitment to offering benefits that are value-added for you as well as your families. As you know, healthcare costs continue to rise, and even within today's current landscape, we at PHMC continue to feel proud of our commitment to bear the lion's share of healthcare costs on behalf of our employees. We continue to look to provide quality healthcare options with choice, flexibility for our employees and your families. This year, in 2017, we will see a very modest increase in your healthcare costs, and you will learn more about the specific plans and the costs starting tomorrow. This year's open enrollment kicks off tomorrow, December 7th, and runs through December 19th. It should be noted that some of our affiliates are not on the same schedule as PHMC and some other affiliates. As a few reminders, any election or changes that will be made will be effective January 1st, 2017. You will see the increase in the biweekly deductions in your first full pay in January. Again, the first meeting will be held tomorrow at 1500 Market Street from 9 to 11 in Lower Mezzanine. Additional meetings are already scheduled at other locations throughout the open enrollment period. And of course, you can always contact us at Ask HR for questions and more information. So as you know, PHMC's investment in our employees expands well beyond the traditional healthcare benefits and includes a whole host of health and wellness opportunities for all PHMC and affiliate employees, such as those you see on the screen behind me. We continue to grow this investment each year and did so this past year with two new exciting offerings. The first one you've heard and seen about throughout the day, the PHMC Early Learning Academy at Center Square, our new high-quality early learning childhood center. Say that again. Our new Early Childhood Learning Academy, Center Square. Say it again. PHMC. Maybe the glasses aren't working. PHMC's Early Learning Academy at Center Square. Our new high-quality early childhood center, offering a significant discount for employees and their families. And second, we've recently expanded PHMC's commitment to our employees' continued learning by investing in academic partnerships with two local outstanding institutions, Drexel University and Philadelphia College of Osteopathic Medicine. It is my true pleasure to introduce Ann Callan, Managing Director of Organizational Development and Learning, to come up and speak for a few minutes on these exciting programs. Thank you, Ann.
Thank you, Celeste. Last year, we did a live poll here at the annual meeting to get your input on academic degrees. What kind of investment in you would be most meaningful? Well, we heard you. There was a majority response to master's degrees, so we got to work. In PHMC fashion, we carved our own path, and we developed and redeveloped new and old partnerships with two of the region's most esteemed schools, Drexel and PCOM, to provide opportunities for students to receive a Master in Public Health or a Master of Science degree in Public Health Management and Administration, respectively. And so, an already transformative experience, grad school, is made even better through the benefits of these partnerships. A cohort of peers from across the PHMC enterprise, new classmates and friends, support systems in place through supervisors, the Organizational Development and Learning Department, and the leadership team at PHMC. New understandings in personal and professional growth, and a new set of ideas to bring to the workplace, changing not just the reality of the student, but the reality of everyone that student touches here at PHMC and in the field, changing lives every single day. And all at a cost that is, at the end of the day, 75% off market rate for you. And that's really tremendous. That's kind of unheard of. So here we are a year later, essays and letters of recommendation submitted, applications accepted, orientation and buying books, and the first day of school for 33 of our own PHMC colleagues. ODL is thrilled to have brought you these special opportunities, and we look forward to doing more in 2017. Developing PHMC's extremely diverse, talented workforce is perhaps our greatest strategy toward realizing the full potential of this organization into the future. This is why you matter. And I'm pleased now to introduce one of our students currently in the PCOM program. She's going to make a couple of remarks. Brandy Upshaw.
Good morning. Yeah. So, I am not the class valedictorian. I did not get picked because I'm the smartest person in the room. Believe me, okay? I just want to pass. From the initial PCOM Master's Overview session, I was immediately encouraged and extremely eager to be a potential candidate for the Master's of Science in Public Health Management Administration. To me, the PCOM program speaks to the vision of things to come for PHMC. In my application essay, I stated that I had the desire to become a better team manager and display effective practices to develop into an influential leader so that I can impact the organization and contribute to the ever-evolving landscape of public health. Being a part of this program allows me to be an advocate for the missions of PHMC and its affiliates. I truly appreciate that PHMC invested in their employees' long-term development. I'm going to ask my classmates to stand from PCOM because we're not doing it alone. And on behalf of the graduating class of 2018, thank you.
Thanks, Brandy. And just to give equal time, could I ask the Drexel students to stand to be recognized? It's an incredible group of your colleagues, and I've had the privilege of spending some time with the PCOM folks, and it's an amazing group doing amazing things. And there's lots of others of you out there that are graduates of these programs in the past. If you haven't done it in the past, please consider joining. It's a very exciting thing, and I want to thank Ann for her leadership of these, and to Celeste, thank you for all that you do in HR. We're coming to the part of the program now that many of you and we're very, very excited about, and that's the 2016 Impact Awards, backed by popular demand. The Impact Award is a way to honor a PHMC or affiliate employee who's demonstrated a clear commitment to PHMC's mission of creating and sustaining healthier communities. Nominations were collected from across the organization, reviewed by a selection committee, and 3 finalists chosen. One of the great things is the number of nominees increases each year, and we encourage all employees to vote, and the number of people voting has enormously increased over time. And now it's time to introduce you to your finalists. Now, you all know we had finalist number 1, finalist number 2, and finalist number 3. This is the big reveal leading up to the selection of the Impact Award winner. Should just say all of these people are winners. They are people that have been chosen by their peers as people having the most impact on the clients we serve. Finalist number 1 can easily be described in one phrase: patient-focused. Understanding that caring for patients does not end when they leave the health center, finalist number 1 engages with counselors, resident staffs, pharmacies, and other clinicians in order to implement a fully integrated care plan. This individual is lauded by peers and partners alike for demonstrating innovative thinking in treating patients as individuals. Finalist number 1 recognizes the, quote, outcomes and successes are relative to each patient, end quote, and by understanding the unique needs and challenges of each patient, he or she is better equipped to succeed. Finalist 1 has spent an entire career serving the mental health needs of a diverse and marginalized population and has done it in so many ways that uplift and motivate patients and colleagues. Please join me in welcoming finalist number 1 to the stage, Rhonda Carter, psychiatric nurse practitioner at Mary Howard. As she makes her way to the stage, and we'll be able to clap some more, finalist number 2 understands the scope of PHMC and how to use the enterprise's reach to deliver better outcomes for those served. Welcome. Working with families who are experiencing homelessness, finalist number 2 strikes a balance between creativity and sensitivity to address child development needs. This individual developed a parent group that offered trainings in mental health, the impact of alcoholism on children and discipline techniques, that impacted on alcoholism on children and discipline techniques. Finalist number 2 is resourceful and uses relationships with peers and other PHMC employees to address and respond to a family's needs and concerns. With the goal of always providing high-quality service coordination, finalist 2 works to ensure that each and every referral received is managed with great care. In fact, families have been heard saying to their families, you should meet with finalist number 2 so you can get the services your child may need. Please join me in welcoming finalist number 2 to the stage, Jacina Whitaker, service coordinator with ChildLink. And as Jacina comes to the stage, finalist number 3 is outcomes driven. Ensuring thank you letters to donors are delivered on a timely basis, coordinating volunteer activities that strengthen relationships with corporate sponsors, developing strategic grant applications that efficiently fund programs and services, with commitment to delivering the best possible outcomes for those we serve. Finalist 3 created a new event in partnership with an outside organization to raise awareness around the critical issues of youth aging out of foster care. The event resulted in more than 60 new points of contact for the organization and strategic thought leadership on a critical issue. Please join me in welcoming finalist number 3 to the stage, Monica Creedy, Development Team with Turning Points for Children. Monica, are you here? Oh, okay. Okay, so I want a huge round of applause. You are all winners in every way, and we all thank you so much. And the terrible part is that we had to have this vote, and one person has to be the biggest winner of all the winners. So there were no losers. There was only the biggest winner, and so Ann is going to bring me the envelope, but it's not an envelope. Oh no! It's a secure sheet of paper. We are so excited to name the Impact Award winner for 2016 is Rhonda Carter.
thank you to the people that voted for me. I'm not really sure how or why, but I think this is for like all of us who work here at PHMC. I haven't been to one of these meetings in a while. Because I was working. And I really did. I forgot how much PHMC does. And I've been here since 1997. And I'm proud of all of us. So this is for all of us, really. I'll just hold it until next year. Thank you.
That's an example of the power of quiet silence. It can be much more powerful than a lot of talking and a lot of words. So I want to thank all of our winners. So congratulations again to everyone. They're all inspirational in every way. And I now want to ask Celeste to come back up to talk a little bit about longevity. We have the high quality and now, as my example, longevity of PHMC employees. So Celeste.
Congratulations to all of the winners and for all that you do. So when you think about your 19 years of service and the other winners' service, it equals the combined service of what we're going to talk about this morning. So at last year's meeting, we celebrated service anniversaries. And what you just saw here from Rhonda and others is an example of between 1997 to 2016 and beyond of what they do to bring the services to our clients and others each and every day. So I'm proud and it's my privilege to announce some additional milestone anniversaries and just think about all that you do and all that they have done in between their beginning of their career here as well as it continues 2016 and beyond. So today, please join me in congratulating the individuals for their impressive. We're going to start out with 20 years of service to PHMC and our subsidiaries. Please stand, honorees, to be recognized by your peers. Renee Coles-Lonchek. Eduardo Figueredo. And please stand to be recognized. Linda Jamison. Cynthia Kelly. Kim McGrory. Dorothy Rich. Anita Williams. Congratulations on your 20 years of service and commitment to PHMC and our subsidiaries. So please join me in congratulating the next category and celebrating a remarkable 25 years of service. Going to Sandra Glasgow. Barbara Lee, please stand up and be recognized. Minerva Rourke, Minnie. Sabrina Thigpen. And our very own Patricia Watson. And last but not least, please help me in recognizing two employees for 35 years tenure, going to Ella Holmes Miss Ella. And our very own, still younger looking every year, Marino Politi. While we can't publicly recognize all of the milestones, we congratulate all of you, and particularly so the milestone winner, those milestone employees and the anniversaries today. We have incredible history here at PHMC, top in talent, and a very energetic workforce. We look forward to continuing to celebrate your service and your service anniversaries in new ways. Now I'm pleased to turn it back over to Richard. Thank you.
Jacob was born in March of 1990. He was diagnosed very early with autism, about 18 months. Around the time that he was 6, his epilepsy emerged, and it's been constant since then. In a way, the epilepsy creates a level of crisis on top of the underlying struggle and the fear and uncertainty about what his future will be. When he turned 21 at the end of the school year of his 21st year, the second crisis occurred, very classically for adults with autism, in that there were no comprehensive services that extended his life of learning. I came to PersonLink because it is the lifeline to getting richer services for Jacob and potentially providing for him a place where he can live. I can email any of them, immediately get an email back. We check in on a weekly basis. They instruct me of things that I can do that can improve Jacob's case for getting more services. I really feel like it's a lifeline, that if there's going to be an opportunity for Jacob to have a richer and broader life, and that he's going to be safe, and that someone every day is going to take the initiative to make his world better, is not just there to get a check and to take care of him, it's because of PHMC, which is pretty amazing stuff.
One of the reasons that we wanted to end with Roy and Jacob is that they're like many, many, many families that we serve. They're another family, but one of the things that we're so fortunate about is that Roy writes letters to us thanking us for what's happened, and the letters are absolutely amazing. Roy's caring for the people that serve him, not just the people at PersonLink, but the people throughout PHMC and our affiliates that he comes in contact with, as broadly as the guards at 1500. And the fact that Jacob is a wonderful, warm person, but sometimes complex, and the caring way in which he has always been met by each one of you that's come in contact with him at PHMC. And so it's just one example of a family whose lives have changed by the caring of what you do, why everything about them matters so much to them, and why you matter so much. So it's our privilege to present that to you. And sometimes if you happen to see them, they're just a wonderful family. As it turns out, Roy Diamond actually worked in the development of Interim House West, so he's also, in a sense, a member of our family in multiple ways. But they're a wonderful family, and I know all of us wish Jacob well. I believe he's now going to have housing through some of the work people have done, and it's a great tribute to the work of the people at PersonLink and the people at PHMC, and I thank you. So this is bringing our meeting to an end. I hope that you've learned a bit more about PHMC, your role as a part of a large public health institute and a network of colleagues, and most of all, to see and hear about why what you do matters so much. I want to again thank the communications team. Lauren, Patty, and Nikki has done an enormous amount of work. All of these films, she's did an incredible amount of work on all of the details of making things go. And I want to thank her for that and what she does all the time. And I would go through the entire communications team and thank them, but we all have other things that we want to do soon. So thank you so much. Now I want you to just sit for a minute and visualize something that happened during this meeting, something that someone said, or something that you saw. And I want you to think about it. Okay, now I'm beginning to get the thoughts in my mind. And the one thought that's overwhelming is that monkey climbing the ladder and what it looks like. And I know that each of you, when you go home tonight, will say to those loved ones around you, you won't believe what I heard today. There's always one of those things that happen. So we're going to go from here. Those of you that go to 1500, please go back. We're going to have lunch together. We're going to talk. Those of you going back to your facilities for lunch. But most importantly, as you have lunch, but as you begin to go back to the work that you do today and every day, I want to thank you so much. I get emotional thinking about it, but it really is amazing what you do every day. And I greatly thank you. I wish each of you a happy and healthy holiday season to you and your family, and thanks for all you do.